Hi, welcome to the University of Winnipeg Virtual Open House. My name is Gina Borges, and I'm a recruitment officer here at the University of Winnipeg. And I am really excited to welcome you here today, specifically to learn about our kinesiology and applied health. We have Dr. Danielle DeFries here, who is the chair of the Department of Kinesiology and Applied Health. And we also have Glenn Bergeron, who will speak on the athletic therapy program as well. So I'm really excited for you to hear their presentations and their expertise on the area. I will be here to answer any questions you may have. You're welcome to enter that. You're welcome to enter your questions into the Q&A function in our presentation here today. And I will be monitoring that as we go along. And also, if you have any questions about just applying to the university in general or anything like that, I'm here to help you with that as well. And I will just enter in the Q&A my email address as well, or in the chat actually, my email address as well. If you have any questions after this event, you're welcome to contact me and I can walk you through anything like that. Otherwise, I will open it up to Danielle, and thank you so very much for joining us today.
Great. Thank you very much for that introduction, Gina. And so again, I'm very happy and very glad that you could all join us here today to learn a little bit more about the Gupta Faculty of Kinesiology and Applied Health. My name is Danielle DeFries, and I'm currently the chair of the Department of Kinesiology and Applied Health, which is one piece of the entire faculty. And as Gina mentioned, a little bit later on, we'll hear from another faculty member in our department, Dr. Glenn Bergeron, who is the director of the athletic therapy program. So he'll be able to share a little bit about that unique program within our faculty. So probably a good place to start. Some of you may be wondering, who is the Gupta Faculty of Kinesiology and Applied Health at the University of Winnipeg? And we're a little bit unique among the different faculties at the University of Winnipeg, because you'll hear the Faculty of Science, the Faculty of Arts, the Faculty of Business, and then we've got the Gupta Faculty of Kinesiology and Applied Health. And so our name reflects the fact that we've been very lucky to have support from a Winnipeg family, the Gupta family, who recognizes the importance of kinesiology and human movement to health. So they've been very supportive of our faculty, and because of that, we want to recognize them. So that's why we're called the Gupta Faculty of Kinesiology and Applied Health. So our whole faculty unit is made up of a couple of different pieces. The one that we're going to be talking about the most today is the kind of academic department. And it's the one that if you do come to the University of Winnipeg and you do come to our faculty, this is the one that you're going to be interacting with the most. So our academic department is the Department of Kinesiology and Applied Health. But we also have our athletics department, and I've put Go Westman here because our athletics department is where we have housed our volleyball teams, our basketball team, and our soccer team. Our faculty is also made up of kind of our key recreational facilities. So the Duckworth Center, which is one of our main buildings, is where we have our gym, the fitness facilities. So if you do come to the University of Winnipeg as part of your registration, I do believe you get free access to our fitness center in the Duckworth Center. And then we also have the Axworthy Health and Recplex, which you can see from Portage Avenue, and that's our sort of our large field with a track. We have some of our offices there. We have a lot of community groups accessing that space. And then in the basement of our Duckworth Center, which is probably maybe where Glenn is joining us from today, is our athletic therapy clinic. So we do have an active athletic therapy clinic in our faculty as well. So that's where we do have practicing athletic therapists, but our athletic therapy students also may be doing some of their practical work within that athletic therapy clinic as well. So normally, if this was a normal year, i.e. a non-COVID year, I would absolutely love to invite all of you to come down, because it's one thing for me to tell you that we've got our Duckworth building and our Axworthy building, but Nothing beats actually seeing what I'm talking about, but so I would love to invite you all to come down and see, but unfortunately at this time, our campus access is still restricted. So I thought the next best thing would be to show you a video that kind of gives you an idea of, our spaces, where we're located on campus, gives you a little sort of virtual tour of our different facilities and talks a little bit about our programs. So I'm just going to start that up for you guys here.
Welcome to the Gupta Faculty of Kinesiology and Applied Health at the University of Winnipeg, located in downtown Winnipeg, Manitoba on Treaty 1 territory. Our faculty is housed in two main buildings on campus, the Duckworth Center and the Axworthy Recplex. We offer 3 degrees, a Bachelor of Kinesiology, a Bachelor of Physical and Health Education, and a Bachelor of Science in Athletic Therapy. Check out our website for more information on each program. When you enter the Duckworth Center, you'll see the customer service desk and entrance to the gym, which is free for all University of Winnipeg students. We also have a classroom, the anatomy lab, and access to the gymnasiums on this level. On the lower level is our athletic therapy center, another classroom, and a lab. On the second floor are the 2 main classrooms in our department. Here's the David F. Anderson Gymnasium, where the Westman athletes practice and play. We also use the gyms for classes within our department. We use the Recplex for other courses such as track and field and advanced resistance training. Some of our faculty offices are here as well. On the 3rd floor of Duckworth, you'll find the rest of the faculty offices, including those for the department chair and the department assistant. Kinesiology is the study of human movement. For your degree, you will learn everything from anatomy, biomechanics, physiology, and fitness instruction, as well as exercise psychology, motor development, health behaviors, and much more. As a first-year student, you'll start your courses with Introduction to Kinesiology and Introduction to Health, which will cover basic concepts important to know for the rest of your degree. You'll also take Nutrition for Health and Wellness to learn about the major nutrients, the Canadian Nutrition Guidelines, and the role nutrition plays in optimal health. Human anatomy is a student favorite, and you will leave the course knowing bones, muscles, and nerves, and the way they all work together to help us move. Growth and motor development teaches you how babies and children acquire movement skills as they grow. In Scientific Principles of Fitness and Conditioning, you'll learn basic exercise prescription and how to measure and evaluate someone's fitness level. There's also a lab in this class where you get to practice fitness testing procedures. In our Promotion and Adherence course, you'll learn how to market and motivate people to take part in physical activity programs. We offer many more courses that lead to a variety of different careers. Here are just a few. Please pause and take a good look at this list. Thank you for your interest in the Department of Kinesiology and Applied Health at the University of Winnipeg. For more information, please contact us or visit our website at www.uwinnipeg.ca/kinesiology.
Okay, so unfortunately, you couldn't pause that video if you wanted to look at that big list, but you can find this video up on our website if you were interested in looking at it again. So it is there for you. Okay, so if you were paying attention to the video, you will already know the answer to this question over here. But if you missed it, because it was pretty quick, we're going to talk a little bit about what kinesiology is before we talk about what we do in our faculty and in our department. And so I've grabbed about 5 pictures over here. They're all different pictures, but they all represent fundamentally what kinesiology means. And if you look really closely at each of these pictures, you'll see there's one common thing, that all of these people are somehow involved in movement. They're all moving their bodies. And that essentially is what kinesiology is. It's the study of human movement, the study of the way that we move our bodies. Okay, which is a pretty simple, straightforward, kind of one-dimensional definition. But when we really start to go a little bit deeper and sort of delve into what human movement involves, you can see how complex it can get and how there is quite an opportunity to study different aspects of human movement. So if we're going to look at how our bodies move, we need to know what our bodies are. And that's really the fundamental concept of anatomy. So what are the bones, the muscles, what are the structures of the body that are involved in movement? And it's not enough to just know what structures your body has. We need to know how they move, okay, and how they work together to produce movement. So anatomy is really the what of the body, and physiology is the how, right? How it all works. Kinesiology in human movement also involves biomechanics, which is kind of the analysis, the quantitative analysis of how our bodies work, how they move, sort of angles and joints and force and speed or velocity. If we're going to move, we have to have something controlling that movement. So there is a little bit of neurology or neurophysiology. And when we start to look at how the brain controls our muscles and controls our movement, it's how we plan out our movements. There's a little element of a big element of psychology and physical activity and movement too. So we also study why we move, how to get people motivated, how to use psychology to get people to be physically active and to move. And human movement also involves sociology. So kind of the group dynamics of movement, more of the societal aspects of how we move and why we move. So because kinesiology, as you can now see, and I hope you appreciate, is a really kind of complex and diverse topic, lots of different sort of sub-disciplines involved. We have a few different degree programs within our department and within our faculty that kind of target different aspects of that whole definition of kinesiology. So our first degree is our 3-year Bachelor of Physical Health and Education degree, which we affectionately call our BPHE degree, because that's a big mouthful. So this degree is really geared towards students that are thinking or pretty sure that they want to be involved in teaching physical education and health. And so with this 3-year degree, there's a couple of different ways to pair it, because we sort of give you with this degree kind of the background knowledge on physical education and health, but then you would also need to pair that with a degree from education, your actual education degree. So if you're pretty certain that teaching phys ed is your thing and that's your passion, that's really what you want to go for, then you might want to consider doing an integrated BPHE with a BEd degree, Bachelor of Education degree. So you do the 3-year BPHE kind of interwoven or at the same time that you're doing your education degree. But if you're not quite sure, or if you want to do just a simple 3-year BPHE degree, you can always do that one degree, finish that off, and then go into education after and do your 2-year education after degree program that way. Okay. Now, in addition to that, we have sort of our 2 other sort of more longer degrees. So we have our 4-year Bachelor of Kinesiology, or our BKin degree. It's a more of a general program, as we're going to talk about, you'll see why. So we have our general BKin degree. We also have an honors degree program. So that's more geared towards students who are interested in learning more about the research process and possibly doing a research project with a faculty member on a kinesiology related topic. And then we do also offer a Bachelor of Science degree for students who are involved or interested in athletic therapy. So if you think that that is more aligned with what your career goals are, then the 4-year Bachelor of Science in Athletic Therapy is going to be the degree for you. And we'll talk about each of these degrees and what makes them special, what makes them different. So again, if you think that you are interested in kinesiology because you want to teach movement and you want to teach physical education and health, then the 3-year BPHE is probably the best fit for you within our department. And so with this 3-year degree, you'll be taking courses like pedagogical theories and models for physical activity and sport, which is really where you learn the basics behind theories of teaching physical activity and sport. And you also talk a little bit about how students, as well as teachers or instructors, fit into that process of how we learn different physical activities in different sports. You'll also take a course called Outdoor Education, which is where we use the outdoors as kind of a classroom or kind of a laboratory to learn about physical activity and sport outside. So in this course, you do get to do some field trips where you're outside. We do run outdoor education in the winter. So we do have some outdoor sports and outdoor activities that you'll learn about with this course. You'd also be taking motor learning and development, which is where you would talk about how humans, how babies and children learn their motor skills, how we plan movements, because that's part of teaching phys ed and teaching health as well. And then we also have courses geared more specifically towards how you teach certain skills and how you teach different sports. So for example, in our instruction in team-based activity sports, you learn more about how to instruct sports in kind of a school setting. So basic rules and strategies, skills that are used to teach different sports. So the career opportunities that you would have with a degree like this might seem initially straightforward, because I just really talked about how this is geared towards students who want to be physical education teachers. So yes, if you're interested in teaching early years, middle years, or high school physical education and health, this would be the degree for you. But we've also had students take this degree and then go on to careers in recreation or program management, or even working in children's activity camps settings. So it's not just limited to teaching phys ed. There's more options that you could have with this degree. Okay, so kinesiology, as you just learned, is a really wide-ranging topic. So to kind of narrow down what exactly a kinesiologist does on a day-to-day basis is a little bit challenging. But I thought it would be interesting for you guys to learn a little bit more about what kinesiologists do, but from the perspective of the clients that they work with. So again, I got a short little kind of 1-minute clip to give you some insight on what kinesiologists do.
Basically, kinesiology is a practical way of looking at the body, figuring out the biomechanics that are working correctly or not correctly.
I would say it's really kind of an interesting process about how we're working with Alfred. It's the only one I've ever worked with.
The doctor should send everybody, whoever has injury, should first go to kinesiologist and then maybe choose another options.
Working with a kinesiologist is unique because they're trained to identify weaknesses in the body. They understand how muscles and structure works, and they can pinpoint imbalances in muscle and strength that leads to poor posture and the ability to execute power moves.
I would describe it as the application of techniques to relieving stress and pain in the joints, muscles, ligaments, tendons that restrict movement, otherwise impair physical activity.
Okay, so if after watching that, or you might even know already that you are destined, you want a career where you help people to move, then our 4-year Bachelor of Kinesiology degree might be a good fit for you. And so this is a general kinesiology degree. So the courses that you're going to be taking as part of this degree run that whole gamut of those different topics that we were just talking about with kinesiology. So some of the courses you're going to be taking are things like exercise physiology, where you learn how your heart, your lungs, how your muscles and your nervous system change and adapt when you exercise and when you're physically active. You'll also be taking biomechanics, where you learn about sort of the quantitative or analytical aspect of movement. But then you'd also be taking different courses like sport and exercise psychology, where we learn about sort of the motivation to be physically active. In sports psychology, you learn how athletes will use different psychological techniques to help improve their performance. And then we have some really interesting sort of specialty courses where you can choose which elective courses you want to take. So some of those elective courses might include inclusive physical activity, where you would learn how to change and modify physical activity for people with disabilities. And in that course in particular, we have students have the opportunity to do almost like a little mini field work or little mini practicum aspect. So outside of class, you get to volunteer with a program for people with disabilities and learn how to adapt physical activity for that. You might want to take advanced resistance training if that's of interest to you. So that's where you learn how to teach specific resistance training techniques, how to be safe while resistance training, and how to design a resistance training program. Of course, it's really relevant for kinesiologists today, exercise physiology and chronic disease. So we know we have a lot of aging persons in our population. So exercise physiology and chronic disease is where you would learn how different chronic diseases like heart disease, like arthritis, like type 2 diabetes, how those affect your ability to exercise. And then one of my favorite courses, because I teach this course, so I have to put in a little plug for it, is Nutrition for Sport Performance, where you would learn how specific foods and specific nutrients can help athletes, recreational athletes and professional athletes, to really enhance their training and performance and make them better in their sport. And so the career opportunities that you would have with a 4-year BKin degree, there's quite a lot here. I'm not going to go through them all, but just to show you that there's quite a diverse set of things that you can do with this degree, anywhere from, being a director of an athletics program, health and wellness promotion. So programs or places like the Refit Center will hire our graduates, all the way down to working as a fitness leader or a fitness trainer, doing fitness programming. Those are all things that you can do with this degree. And if, one degree is not enough, if you finish your bachelor degree and you think that there's more to learn, your Bachelor of Kinesiology degree is also a launching point for graduate studies and graduate schools. So you can use this degree for graduate opportunities in sports psychology, sport management, even in exercise science or exercise physiology as well. Okay, so I think I saw Glenn here.
Yes. Thank you so much, Danielle.
You're welcome.
That was a very comprehensive overview of the program. Kind of makes me want to change my career path now. But,
it's never too late.
That's right. For now, I will avoid doing that and just introduce Dr. Glenn Bergeron, who is here to speak on athletic therapy. Glenn, you'll be happy to know I tell everybody that you're kind of our resident superstars. You were an athletic therapist for Team Canada in the Olympics. So yes, I'm excited for you to listen to Glenn's talk today. And also, again, just to remind you, if you have any questions, please feel free to enter them into the Q&A function, and I'll be happy to monitor that for you. Thank you.
Thank you, Gina. And Danielle, thank you very much for a comprehensive presentation so far. I hope I can keep the standard up to the level you've brought it. I'm being tasked with just giving you a little bit of a presentation on our Bachelor of Science degree in athletic therapy. And I thought just to begin with, I would just show you a quick little video on what an athletic therapist does. This was brought to us by the Canadian Athletic Therapists Association.
I reconnect everyday people with motion, their ambition with results. I cheer from the sidelines and respond from the front lines. I'm first to your aid when aches, sprains, and twists stop your play. Ankles, shoulders, knees, I get you back to form with ease. Injury is my domain, your body in pain. Rapid return to work and play is your will and my skill. I accelerate your healing with holistic reconditioning, your healthy movement through active rehabilitation. You wake, work, live, then repeat. I assess, condition, then treat. Your recovery knows healing hands. Athletic therapy is for everyone. See a certified athletic therapist for injuries to your muscles, bones, and joints.
Great. So I like to think that I do a lot of the things that this person has indicated in the video, except for rhyming. I can't do rhyming. I can't do that kind of stuff. But essentially, the athletic therapy, as much as this video has indicated, it's a caring profession. And it's a profession that really spans a lot of different population types. So we really speak to the fact that we are specialists in muscle, bone, and joint rehabilitation for the active individual. And that means it's not just an athlete as we would traditionally define an athlete as a person who's playing with a team, et cetera, et cetera. We actually talk about the physically active individual would be somebody who's a weekend tennis player, who is a person who just maybe plays at the amateur level. But also we also think about the people who are in the workplace environment as being our athletes as well. We refer to them as industrial athletes. And essentially, if you sprain an ankle on a basketball court, or where you sprain an ankle on a job site, it's still a sprained ankle. And when we talked about the basics of the program that we're talking about here, Danielle mentioned about anatomy. It really is the basis of that. It's the anatomy that we're working with. And so the muscle, bones, and joints are our canvas, if you like. And we play a role through the whole continuum. The very first part of it is that we want to be preventing injuries in the first place and enhancing performance. So we would do conditioning exercises for our athletes. If we're working in a team environment, we would try and find ways of preventing injuries in the first place so that our teams can perform at their optimal level. And then we also then work on the field at the time. Like, we have direct contact with athletes. So and during practice time and during games, we're on the field in the event that an injury happens. And when it does, we're first line defense. We're the first people to go in and determine what the injury is, and provide the very first most appropriate treatment. And the things that we see will have a continuum, and I refer to them usually as life-threatening situations. So if somebody were to have a cardiac arrest, or somebody would have a respiratory problem, or maybe they've had a spinal cord injury that affects them, or they have a severe brain injury, a concussion. These things can be life-threatening, and our graduates are trained to deal with that at a moment's notice and provide the best possible care, and obviously the best possible care is for that person to survive. So life-threatening is a very serious responsibility we have. The second is limb-threatening. Limb-threatening really talks about whether or not we have the potential of being paralyzed from with either from the neck down or from the waist down because we've had a spinal cord injury, or potentially we've had a major fracture that's affected a major blood vessel that affects the blood flow to that limb, and we may end up losing that leg because of the blood flow, the lack of blood flow. These are things that we would want to be able to recognize right away and to treat right away to make sure that we provide the best possible opportunity for survival and recovery. And then after that, and this is where we see most of it, where we see people are going to be musculoskeletal joints. They're no less important, but they're not as life-threatening or limb-threatening. So if somebody sprains an ankle or tears an anterior cruciate ligament of their knee or dislocates their shoulder, these are all things, as well as I indicated, they're serious, but and we're also there to provide the most appropriate care to the person as well. So we're there to prevent them, but when they happen, we're there to provide that the immediate on-field care, and sometimes it means referral through ambulance and onto medical care. Subsequent to that, once the injury has been properly cared for on the on-field setting and they've had a proper assessment, then we will see them in a clinical setting, and we will then work with that athlete on a daily basis to bring down the swelling, to reduce the pain, to increase the range of motion, to increase their strength, to increase their power, increase their endurance, and reintegrate them back into their sport. And then we want to get them back to their play, hopefully at least as fast and as strong and as powerful as they were before the injury, but even preferably even more so, because we've had an opportunity to correct some inadequacies that may have had occurred from the injury. So it's a wide spectrum of things that we do. Some of our graduates will work exclusively in a team environment. Other people work exclusively in a clinical environment. And some people work in both of those environments. So they see their athletes on the field or on the ice, and they treat them as well afterwards. So there's a wide spread of of athletes and do that. And again, when we talk about it in clinical, then we're talking about people who are seeing patients coming to them. And we see the full gamut of people. I see people from the age of 4 years old to our oldest patient at the University of Winnipeg, where we treated this person for a knee replacement, was 101. And so we have the full gamut of people we have that way. So I'll give you a little breakdown about what that does. I'll talk a little bit about the program. And we have what's referred to as the enhanced major in athletic therapy. And so it's a major 4-year degree. It's a major degree in athletic therapy. We've referred to as the enhanced major because we've just gone through a big review and a big revamp of our program. And largely the biggest thing that we've done is we now have an entrance requirement. Whereas in the past, students were able to come in their first year and make a declaration, they declare their major as athletic therapy, and they continue on to the 4 years. And one of the things we're finding is that sometimes people are coming in without really fully understanding what it is that athletic therapy is, or what even some of their other options are. And they come in and they sort of commit to this when in fact, maybe they might've been more interested in something else. And so what we've done now is we have an entrance into the athletic therapy program after your second year. So the year 1 and year 2 are prescribed and that are general, there's sort of general kinesiology. You come in as a major in kinesiology and you take your first 2 years of kinesiology, and we tell you, we recommend the courses that we think we need you to take in those first 2 years. And then based on now you've spent 2 years and you've got a real good idea what kinesiology is in its biggest, broadest sense. And you say, I still want to do athletic therapy and I have the grades to do that. Then you can apply for the third year, which is our program. So in order to apply, it comes into the third year program. So you would be changing your major from kinesiology to athletic therapy if you're being accepted. So that means you have to complete the 60 credit hours, which is the 2 years, first 2 years. You have to have a GPA of 3.0 or higher, and this can be competitive. And the reason why we're saying that is that it's a very, very intense program. And so we want to make sure that you're academically prepared to be able to take on the challenge of the program. It's quite challenging. You will also be asked to submit a letter of submission. So it's essentially a letter saying, why is it that you want, after looking at the last 2 years, why is it that you still want to do athletic therapy? What's been your experience? We're going to ask you in the first 2 years, if you're planning to do athletic therapy, to go out and meet with athletic therapists in the field and spend time with them and interview them and get to know what athletic therapy is. So that when you come in and make the commitment in your third year, you know what you're getting into, you know the pros and cons of the profession, and you're still committed. And the intention is to finish the full program, third and fourth year. We're going to ask for reference letters. We ask for 2 reference letters. The application date is April 1. So you'd be applying immediately after your second year, you'd be applying to the program. In terms of sample courses, the types of courses that we take, you should know that this athletic therapy program, the last 2 years are very intense, and they're essentially a medical program. So this would be like you coming into medicine or into physiotherapy or occupational therapy. It's an intense program. We anticipate that you know your anatomy and your physiology, your biomechanics. You've got a reasonable handle on that because you've got a GPA of 3.0 out of 5 or higher. And then so we become much more specific. We're going to do things like therapeutic modalities in sports. You're going to learn how to do electrical muscle stimulation. You're going to learn how to use ultrasound, laser therapy. You're going to learn how to use the modalities and what's the most appropriate time to do that. We're going to do assessment of the upper and lower body of injuries. And I teach this course, and you're going to learn well over 120 different special tests for each joint. You're going to learn become a sport first responder. That this is giving you the tools that when you have that life-threatening situation on the field, you know how to deal with it. So you're going to be a first responder, much like what a paramedic would have as well. We're going to teach you how to assess and treat injuries of the spine, neck, low back injuries, be they traumatic injuries or chronic injuries. And then we're also giving you an opportunity to get out into the field and apply those skills. So you're going to do 2 practicum courses. Each one of them are roughly 250 hours. So by the end of the 2 years, you're going to have done 500 hours of internship, working hand in hand with certified athletic therapists in team and clinical settings and honing your skills so that when you graduate, you have all those skills that you can now start to treat patients. We can go to the next slide, Danielle. Career opportunities for athletic therapy. Obviously, I've mentioned a lot about this professional sport teams and also amateur teams. Like if we just finished with the Winter Olympics. Many of those teams, be they the snowboarders or the skiers or the figure skaters, have athletic therapists as part of their team, either on a part-time or full-time basis. So there's a big job market for our summer and winter Olympics that you can work with. It gives you an amazing opportunity to travel the world. And so that's a great opportunity. A lot of people work in private practice as well. So there's insurance coverage for athletic therapy through Blue Cross, through workers' compensation, through Manitoba Public Insurance, and a whole host of other different insurance companies so that you can get reimbursed for your services. Some people will work in case management. So we have some of our graduates that are working with Blue Cross, Investors Group, Wawanesa, Great West Life, and Manitoba Public Insurance, and they work as case managers. So when people have had a motor vehicle injury or work-related injury or some kind of an accident, they will be the people who would assess the person's rehabilitative needs and manage the people who needs it. So do you need to see a doctor? Do you need to see a therapist? Do you need to see a nutritionist? They would manage all of that. So they have the skill sets to be able to do that. I mentioned industrial health and rehabilitation. So big market in here where some of the companies are now hiring athletic therapists full-time on their teams. Boeing, for example, Air Canada. A lot of the pulp and paper industries hire people to work with their people. So there's a growing market in that area. And then, as Danielle has mentioned, with some of our other programs, you can go on to graduate school. Our profession is always in need of people who are going to be able to advance their education and be able to advance the profession of athletic therapy, the knowledge base, through research and through teaching. And I've been fortunate enough, I've been at this for 47 years, some of it working with professional teams, amateur teams, Olympics, but I've also had the opportunity to work at the University of Winnipeg and the University of Manitoba in the clinical side of things and in the teaching and research side. So there's an awful lot of opportunity for you to teach, to get involved in that area. And additionally, the degree in athletic therapy can be a stepping stone to some other ones. You can do a master's degree in athletic therapy. You can do a PhD in athletic therapy. You can do a master's degree in physiotherapy. You can do their programs as a physician assistant at the University of Manitoba that you can do as well. So there are a number of other healthcare related programs that you can move into with this degree. And the degree gives you a really amazing foundation. We've had some of our students have gone on to medicine and they're physicians now and they're sports medicine doctors. And this has been a great grounding for them as well. And I think after that, I think that's as much as I'm giving. So the next thing we'll probably go over to Danielle to talk about our chiropractic program.
Yeah.
Sorry, before you do that, Danielle, you did have a question in the Q&A function here for Glenn. Could you describe the difference between a physiotherapist and an athletic therapist?
If I had a nickel for every time I've answered the question. I guess if we go back to the grounding and the academic preparation of the two groups, if you look at the physiotherapy program, essentially it's divided up into 3 different areas. It's into cardiorespiratory. So cardiorespiratory would be working with people who have respiratory problems, have had heart attacks, et cetera, who have asthmas, who have emphysema. They would work with patients like that. The other is that they would look in neurological. So patients who've had strokes, patients who've had spinal cord injuries, they would work with people with a rehabilitation with that population. And the third one that they do is musculoskeletal. And so they also work with muscle, bone, and joint. And we like to think that that the preparation that a physiotherapist has got the breadth of all those areas. Whereas with ours, when you look at our program, it is focused on the muscle, bone, and joint. Yes, we do some cardiorespiratory. Yes, we do some neurovascular, because we have people with low back injuries and disc problems, et cetera, et cetera. But that's not necessarily the expertise. The expertise is muscle, bone, and joint. And so where the confusion comes in sometimes is in the marketplace, because physiotherapists, if you think about cardiorespiratory and spinal cord injuries, et cetera, those patients are going to be found largely in the hospital setting. But there are physiotherapists who don't work in a hospital setting, and they work in private practice, much like the athletic therapists work in private practice. And the people who come into patients you get to come to private practice are largely going to be muscle, bone, and joint. So physiotherapists will work with people with muscle, bone, and joint. We will work with muscle, bone, and joint. Where the bit of the difference is with us is that we've got this whole on-field first responder, managing life-threatening injuries. That's an area of uniqueness for athletic therapy. But when we meet in the middle, if you're looking at them in the clinical situation, then both of them are working with clientele with the same injuries, muscle, bone, and joint injuries. And that's where sometimes the confusion comes into, what's the difference between the two of them, because that's what you see. But you don't see the people who are working, on the either side of the continuum. So yeah, I'm hoping that answers the question for you. If not, then feel free to get back to me, and I can certainly provide you with more information.
Thank you very much, Glenn. And I think we're going back to Danielle, right?
Yeah, so I was just going to say, if that wasn't enough for you, we have another option in our faculty if you're interested. If you are interested in becoming a chiropractor, we may have a place for you in our faculty as well, because recently, I think this is maybe only 5 or 6 years old, but a fairly recent program, a fairly recent partnership between the University of Winnipeg and the Canadian Memorial Chiropractic College in Toronto allows students to complete 2 degrees, a BKin degree and a Doctor of Chiropractic degree in 7 years instead of 8. So we call this our CMCC pathway. And so how this works, students would come to the University of Winnipeg and come to our program and enroll in the Bachelor of Kinesiology degree. You do your first 3 years of the BKin degree here at U of W. And in your second year, you apply to CMCC in Toronto for acceptance in their Doctor of Chiropractic program. So if your application is all complete and you meet the criteria, then you would be accepted to the CMCC. You finish your 3rd year of your BKin, and then you move over to Toronto and start the Doctor of Chiropractic degree or program at CMCC in Toronto. And that would take you 4 years. So at the end of that whole process, what you end up with is 2 degrees. So you end up with a Bachelor of Kinesiology degree, as well as a Doctor of Chiropractic degree in 7 years, where normally it would take you 8. So this degree has a little bit, or this pathway, I should say, has a little bit of intricacies to it. So we do ask our students, if you are interested at all in this pathway, please come and identify yourself to me, to the department chair, as early as you possibly can, just so we know that you're on the right path and you are sort of, set up for success through this pathway right from the very start, because there are certain courses that you need to take within the BKin degree. So if that's something that interests you, you're always welcome to contact me for more information about that.
Danielle, I was just, maybe if I can just add a little bit to that. So the beauty of this is that you get early access to the chiropractic college. Like, you get to apply in your 2nd year, and otherwise most people don't get to apply until after their 3rd year. So you get first dibs on that position, and if you get accepted at the end of your 2nd year, obviously then you complete your third year. But given that you keep your GPA up, you're guaranteed that position for that spot. So it really, if this is what you're looking to do, it doesn't. This provides you that opportunity. It's the same number. You'd have to do the same number of years, irregardless. But the beauty of it is that you come out of it, and we accept 1 year of the chiropractic program towards your 4-year BKin degree. And so that's how you get the 2 degrees out of there. And of course, now you've got flexibility, in terms of you've got a sport background, you've got a chiropractic background, and they're in much the same way as the athletic therapists work with sport. There is the vision of chiropractic as well, which is sport chiropractic. You do, I think, 1 or 2 more years of continuing education program, but then you become a sport chiropractor. As Gina's indicated, I've been involved at the Olympic Games, and we work with chiropractors as well. They're part of our healthcare team at an Olympic Games as well. So it does still give you that opportunity, if you like, to work in the sport environment as a chiropractor. So there's some benefits there. Thank you.
Thanks, Glenn.
Thank you very much. I know that you still have more to discuss, Danielle, so thank you so much. But I just wanted to quickly interfere here for a second.
No, not at all. Not at all. More questions probably, right?
Yes.
Yeah.
There was a question in the Q&A about certification as an AT. So the answer is yes, there is a national certification. Glenn, if you wanted to speak to that a little bit. I'm not sure what the certification branch is called.
Yeah. But, yeah, actually, that's a very good question. So once you finish your degree in athletic therapy, you have your enhanced major, you are now qualified to write the national exam with the Canadian Athletic Therapists Association, which they're the ones who give you the right to title of athletic therapy and the license to be able to practice in across Canada. And so the exams are run twice a year, once in June and once in December. And they're now, it used to be a written exam and a practical exam, and now it's just a written exam. And they've also even made it more convenient that it's an online exam. So you would go to a test site and you would do the exam online. It's 200 multiple choice questions and inside of 3 hours to get your certification. I say that really quickly. You have to really prepare for that exam. So it's but again, at the same time, we like to think that our students are well prepared, and we do help even after they've graduated. We facilitate with a learning and help them to get prepared for the exam. Okay, I think that's probably answered that question.
Is that it, Gina? Are there more questions?
Not at the moment, no.
Okay.
So I will let
Okay.
you continue. Thank you.
I don't want to cut anybody's questions off, but okay. So some of the other opportunities outside of just our strict degree programs that students might be interested. When you're in class at the university and you see your instructor or your professor up there, you're seeing them in the context of them being a teacher. But a lot of the professors that we have in our department are also researchers. Who are, they have their own research programs that look at different areas of kinesiology, exercise physiology, sports psychology. And those professors are, more often than not looking for help with their research projects. And we have lots of our opportunities in our faculty and in our department for students to get involved in research projects and get a little bit of a taste and a flavor of the research environment and what running a research project is like. So if this is of interest to you, if you want to learn a little bit more about the research process, there's a couple of different ways you can do this. So one of our BKin degrees is an honors degree, where as part of that degree, you are required to carry out a research project. So you'd be involved in collecting data, in analyzing data, you might be involved in the ethics applications, but you get to see the research program from start to finish. If that's not of interest to you, we still do have lots of opportunities. A lot of our faculty and our researchers do their research in the summer months between May and August. So we do hire students as research assistants to help with those sort of shorter term projects. So just some examples here of some of the projects that our students have been involved with before. We've had students looking at in athletes how valuing mental toughness has to do with mental health in elite sport. We've had students look at, do some experiments or some surveys with other university students looking at how, students adhere to movement guidelines and physical activity guidelines and how that impacts their sleep. We've had other students looking at more exercise physiology and respiratory physiology, looking at predictors of respiratory flow limitation during exercise in healthy females and males. So if research is of interest to you, and I should say too, like this isn't limited just to students who are thinking they want to have research as their career or maybe want to go on to grad school. There's lots of good skills that you can get from being involved in research, critical thinking skills, communication skills, perseverance. You learn a lot of those lessons from research that you can take to any career that you go to later on in life. So if this is of interest to you, the best thing you can do is just reach out to your professors and just ask them what they're doing, see what their research programs are like, ask them if they're looking for some help. We love talking about our research, so we will never say no to any student who's interested in learning more about that. And just to quickly finish up, I also wanted to mention a little bit about our student group and our student culture. So university is not just about studying. That's a big part of it, but another big part of university experience is, to get to know your fellow students and to be, part of the sort of a student team, I guess you could say. So our student group is called CATSA, the Kinesiology and Athletic Therapy Student Association. This is our group of CATSA executives right over here. So this group of students is really involved in sort of organizing students and getting students aware of various things that are going on in the faculty. They hold different faculty or student events, I should say. This was a little bit more popular before COVID, but there would be get-togethers where you could meet fellow students, get to learn more about your classmates, meet new friends that way. They do post a lot of job and volunteer opportunities on their social media pages. So giving you an opportunity to get involved in aspects of kinesiology outside of your degree. They organize the grad dinner and dance. They do some networking events. So if you do come to our faculty, there is kind of an opportunity, a good chance to get sort of more involved in your student cohort and learn more about your fellow students. Okay, so this I think is probably one of the last slides, but really important. So if you're thinking that the Faculty of Kinesiology is where you want to come, you're obviously going to need to know what you need to be bringing with you when you come here. And so because we have those different degrees, the actual entrance requirements for our different degrees are slightly different. So for the 3-year BPHE degree, it's pretty straightforward. You only need to meet the general entrance requirements or the general admission requirements for the University of Winnipeg as a whole. Okay. So kind of along the same lines for our 4-year BKin degree, technically it is just the general requirements as well. So as long as you meet those minimum admission requirements for the University of Winnipeg, you will be fine. However, we do strongly recommend that if this is the degree that you're thinking of taking, that you do take your pre-calculus or applied math 40S. You don't absolutely need it, but it will be helpful for you for some of those future courses that you're going to be taking. And I'm thinking biomechanics in particular. So there are some courses that having that 40S math will help you out with, but it's not required. For the 4-year BSc in athletic therapy, it's the general entrance requirements plus. So you also do need to have the pre-calculus or applied 40S math. That is a requirement for entrance into the BSc athletic therapy degree. So that's a little bit different, something to take note of. Okay, so I realize that Glenn and I have thrown a lot of information your way in a relatively short period of time. So if there's anything that we haven't addressed or anything that you wanted to go over, a really great place to start is to go to our, it says departmental website here. That's a pretty good place to go. We also have a faculty website too that will likely direct you to the departmental website, but our webpage is a really good source of information. So you may just want to start there if you're looking for some basic information about our programs and our degrees. All of it is there, our honors program requirements, AT program requirements, answers to general questions. If there was a more specific question, more directed question that you wanted to ask, I'd encourage you to send it to this email over here. It's just our general kinesiology email address. Our departmental assistant, Sandra, monitors that email, and she is really good at directing questions to exactly where they need to go. So if you have an athletic therapy specific question, Sandra will take that and direct it probably to Glenn, because he's the source, best source of information on that program. If it's something more general about one of our other degrees, then she'll make sure that I get it, or she might be able to answer it herself as well. So if you wanted to send an email with any questions to that email address, you can do that as well. And we do also have Twitter and Instagram accounts. So if you wanted to follow us on there, please do so. And I think that's it.
Thank you so much, Danielle. Thank you for speaking on the chiropractic stream and kinesiology overall, and Glenn for athletic therapy. We do have just a couple more questions in the Q&A that have popped up in the last few minutes. So one is how many people are accepted into the athletic therapy program on an annual basis?
Yeah, that's a good question. We anticipate somewhere between 20 and 25.
Excellent, thank you. And if someone is interested in pursuing occupational therapy in an undergraduate program, so you can absolutely choose the pre-occupational therapy major on the online application. However, if they were interested in doing a degree, an undergraduate degree in kinesiology first, would that be recommended for someone interested in occupational therapy?
I guess I can speak to that. I would certainly recommend kinesiology degree, because it does give you the anatomy and the biomechanics and the structure and the function. It gives you a real strong foundation into the program. What I would advise you to do is to go to the occupational therapy a website if you're going to the University of Manitoba, for example, and be very, very familiar with their entrance requirements. They will have specific courses that you are required to take to apply to their program. And I know we've spoken to them. And so we've got some of our University of Winnipeg courses will directly apply to their program. So, but you need to make sure you talk to them and you're very clear on the course requirements that they have, so that you can, tailor make your program here and make sure it fits their requirements.
Well, thank you very much. I learned so much today about the programs, and so I'm very grateful to you both, Danielle and Glenn. And again, if you do have any further questions, you've slept on it tonight and wake up with some new questions, please feel free to email kinesiology@uwinnipeg.ca, or myself. I can help guide you through the application process as well. And I did put my email address in the chat, g.borges@uwinnipeg.ca. So thank you so very much for joining us. Please be sure to check out all our other webinars on our open house. We have Faculty of Science at 6 p.m. today. That's Central Standard Time. And over the next 3 days, actually, we'll have different webinars coming up. When is the upcoming session for Faculty of Science? So in about 30 minutes. So thank you so much for coming today. And yeah, we hope to see you all soon. Take care, everyone.